Welcome back, guys, to a new edition of Health Talks, brought to you by Medical Expo Africa events. Today I'm joined by two lovely doctors. I'm hoping they can introduce themselves.
I'm Dr. Nyamurungi TMR International Hospital.
I'm Dr. Kunsa Hudson, working with the Holy Cross Orthodox Hospital, Namukeera.
And I am Dr. Nabukeera Swalha, working with Children's Clinic Nalia and Nigeria. Today we're going to talk about a very interesting topic, as we do with every health talk. We're going to talk about cancer. Dr. Brianna, what exactly is cancer?
In simple terms, so cancer is, if you were to think, just to break it down, it's abnormal growth of abnormal cells. So when someone has cancer, the thing that is most significant about cancer cells is that one, these cells don't die, or if they're to die, they die at a rate that is slower than other cells. So normally in our abnormal body physiology, cells are supposed to die. Just like how you can grow hair and it gets old, it falls off the head, the cells are supposed to die. But when it comes to cancer, when someone has got the mutation that is going on, so what things that are triggered inside there, and eventually you find the cells kind of become like rebels in a way. So you find that the cells, one, are mutated, meaning they're kind of abnormal, but two, they do not die. And three, they grow at a very, very high rate. So because of these things, eventually you find that someone who is having cancer, they have abnormal proliferation. Depending, sometimes that's why you find some people have like masses, they have like skin lesions, wounds, things like that don't heal because of these features. Yeah.
Yes, so we're going to talk about some of the commonest cancers in Uganda. Yes, Dr. Hudson, what do you think is one of the most common cancers, and maybe you could talk about it and what brings it on? How can I know that I have this type of cancer? Yes.
Okay, thank you, Dr. Salva. So we have some of our cancers, the way they have been defined. We can have like a number of cancers. We just know that every part of your body is capable of getting cancerous, right from the bones to the soft tissues that you're seeing. You can get cancer in the eyes, you can get cancers in the ears. So like literally every part can get cancers. But we have those parts that are commonly attacked by cancers. If we talk about like women, we have cervical cancer, we have breast cancer. In male, we have prostate cancer, so among others. So let me talk about breast cancer in particular. And with breast cancer, as we discussed about, there is one of our session where we talked about the breast. So the breast can also be attacked by cancers. Yes, so when the breast is attacked by cancers, like every part, the way we talked about the nipple, the tissues inside, the skin, so the tubules, the sac that store the milk, all those areas are capable of getting what? Cancerous. So in these cases, like if a woman gets breast cancer, you will see like the sum of symptoms that we talked about. Things like you could get a lump that is either painful or painless. You could see like the nipple can start bringing some blood discharge that could be bloody or non-bloody. You could have like other features. If like the cancer, let's say, spread to the lungs, someone can start coughing. And to be particular, if someone is coughing blood, then we likely suspecting a cancer. So a cancer can start in your breast and it spreads to the rest of the body. And at the same time, a cancer can start from somewhere else and it spreads to your what? To your breasts. So those are some of features that you would see. Like you can look at the skin, the cancer would, the breast can change, the skin color and the texture can change. All these can be features of cancers. Yes, and we have like in women, we have what we call risk factors for developing these cancers. We want to make this clear that risk factors do not mean or directly translate to causes, because a woman could have these, she develops the cancer, or she may not have any of them and then she develops the cancer. Yes, so these are just risk factors. So when we look at things like age, we know that breast cancer usually increases with age. And we have family history. We have inheritance, like there are some of the mutations that can be inherited and they increase the chances of a woman or anyone getting breast cancer. Yeah, we can have personal history. By personal history, we mean like if you've had cancer in one breast, and it's very likely that you could have also it in another breast. Sometimes also if you have other cancers like the ovarian cancer, it increases your chances of getting what?
Breast
Breast cancer. And we also have some other risk factors like the ones which can be modified. According to the studies that have been done, we find that people who smoke, who take alcohol, who have reduced physical activity, and who are overweight, usually the BMI of above 30, these people are at an increased risk of also getting what? Breast cancer.
Okay.
Yes. And this breast cancer, it's very, when you are able to detect it early enough, it is a cancer that you can treat and someone cures completely. And at times also when you get it early, you might find that also the survival rate and the quality of life is also improved. Yes.
Okay. Yes, Dr. Brianna, could you throw more light on the most common cancers that we're having in Uganda?
I think that depends on, is it in the men, in the women, in the children, different groups, because now, like you have in children, there are cancers that they're predisposed to. We have also cancers that are predisposed to men and in women. But however, in my practice, I think I have seen particular cancers a bit more than others, although you may have some information that is documented a bit differently. For example, the cancer that I have seen the most commonly, one, the breast cancer that you talked about, two, the cancer of the cervix, especially in HIV positive patients. And then in children, mostly I've seen retinoblastoma. So this is where the eye gets infected, depending. Those are, I think, the cancers I've seen the most. Then the one maybe we've seen also, there's a bit of ovarian cancer. The problem with ovarian, I think, like we shall see, is that it's a silent killer. So by the time it manifests, someone is already like in the last stages. So yeah, I think those are kind of the common cancers that I can talk about. Maybe if you talk about like, for example, in the children, I think the cancer which I saw the most commonly in children, for example, the retinoblastoma. This is where the child has, so it's a cancer that's in the eye, so it affects in the eye. Now, in simple terms, this thing can be diagnosed, it's normally diagnosed even within the period of 20 months of age. So that is like between the first 2 years of life. And the children begin to manifest symptoms like you see, there's something called leukocoria, so it can look like a reflection or something whitish or discolored within the eye when you look there. That is one thing. So regardless of whether it's cancer or not, if you ever see any manifestations like this, of like of that abnormal coloring in the eye, do not leave it be, because these are the early stages and retinoblastoma can be well treated. Its prognosis is good when treated early. The problem is that in our low resource setting, and actually the patients that I have seen are always down to present late. So we call it the exophytic one, whereby the patient begins already manifesting, the eyeball is popping out and it's eating them up and it goes into the brain. That is the one which is kind of a bit tricky. Then maybe there's a lot of like Burkitt's lymphoma because we are malaria endemic. So maybe people don't know about the Burkitt's. This is the type of cancer which is normally endemic to areas that have malaria and then a virus called Epstein. So Burkitt's interestingly is also very common because of the HIV rates that we have. It's also very common in people who have HIV. But also interesting that it's common in people who have a higher CD4 count, so above 200. So the virus, the EBV, the person has the EBV that is in there, malaria comes into the picture and then it activates it and begins causing the mutation. The thing that's interesting about Burkitt's is that it grows too rapidly, in that in a period of like 25 hours, you can have a doubling of the mass. Like in a period of 1 day, like in a 1 day period, it has doubled. So these are the types of things that we want people to be aware about. You begin seeing your child, for example, growing a swelling on the jaw. Don't keep them at home. begin seeing the eye looks funny, or they're having, so like retinoblastom, they have like a squint, they begin to have something strange in the eye, please do not leave your child home for these particular reasons. Learn these things and do better. Yeah.
Then also I'll try to shed light on cervical cancer, which is actually one of the leading causes of cancer in Uganda right now. So we see that most people are diagnosed quite late. So I want to throw light on some of the signs and symptoms that may show you that you may have a problem and you actually need to do what? To go and seek medical care. So for example, if you are a menopausal woman, say your periods like ended when you were like 50, you understand? So, and then you start seeing bloody discharge. Yes, there are postmenopausal symptoms, but usually they take about 2-3 years and then you completely cease having menstrual periods. However, if even when you stopped your period 10 years ago, you're starting to see bloody discharge. This bloody discharge is foul smelling. You also have a type of discharge that smells like rotten blood. You understand? If, for example, for the younger ladies, or even the postmenopausal women, if you start getting, for example, you get after your menstrual period, before another menstrual period occurs, you get bleeding in between. You have to take care of that. You have to actually be cautious, and you need to seek medical help. Then another thing is when the cancer actually spreads to other parts of the body, which is actually very possible because it also spreads quite fast. So it can spread to the rectal area. So you start having symptoms like diarrhea, bloody diarrhea sometimes. It can spread towards the bladder area. So you have frequent urinations, painful urinations. And for the sexually active, you have pain while having sex. You need to take note of these symptoms so that you can go and seek medical care. And if it's caught earlier, it can actually be managed very well.
I think actually in addition to the cancer of the cervix, the reason why I find it particularly interesting is because I've seen quite a number of patients with cancer of the cervix. Granted, these have been mostly in rural areas because, again, these people, number one, are afraid to go to hospitals because they're actually because of the financial limitations, but also they tend to sit with things longer.
Yeah.
But normally, other risk factors that are very, very critical in cervical cancer, one is HIV. If someone is HIV positive, you must, and the screening that is for someone with CS cervix or cancer of the cervix is much more regular. Number two, if someone has begun having sex when you're still younger. So like we talked about in the show of contraceptives, there's sometimes when you find someone begins having these things, if you've begun having sex when you're still younger, the reason why it's a predisposing factor is because one, chances are you're going to have many sexual partners, and number two, chances are that even if you have one partner, chances are from when you are like having sex with a person from when you're 14, the person has other partners, and the man is going to carry this HPV. So the virus so cervical cancer is actually caused by a virus. It's called HPV, human papilloma virus. It has variants, and some of its cousins of cervical cancer is genital warts. Some people begin having warts. So we have some images, by the way. Let us know if you guys would be interested in seeing images, because these images are quite graphic, but you let us know if you want to see them. So these are some of the types of things. Another thing is when you have sex and you bleed. So we call it contact bleeding. She spoke about pain when you're having sex, but pain is one thing in itself. Bleeding, honestly speaking, do not sit with a bleeding cervix. If you ever have pain when the moment someone touches your cervix, or when you're having sex, every time you bleed, please make sure these things are checked out as soon as possible. So we'll talk about the screening modalities, but I think that's something we need to make sure that is very well known.
Okay, maybe to add on that, for the women who still have their periods, if you see your period is usually taking longer than normal and you have spotting in between periods, you need to take note of that. Then maybe another thing that we could talk about is this HPV. I know people are very skeptical about vaccinating lately, but vaccinating against HPV for children who are virgins, how old? 8 years? 8 years old in schools actually can help reduce the children from having what? HPV, contracting HPV. And also, like we said in contraceptives, it is you as an individual who needs to take care of yourself first. Carry condoms with you. Women, carry condoms with you whenever you're going to engage in sexual intercourse, so that, because it's men who spread this virus, and the virus is the major cause of cervical cancer. Okay, and another thing that we should do is have regular screening. Now, for example, women who are now from an age of 25 between 30 should start having regular screenings for cervical cancer. If they get just, like we call it carcinoma in situ, the cancer is just beginning. They can actually do some surgical interventions and they remove it, and then you actually cancer-free most of the cases. So I think we need to look into that more. Go to your health professionals, do some we call them pap smears, make sure that you're very diligent with your health, especially for women of reproductive age, even postmenopausal women. And also, if you have HIV, you need to go for regular screening of cervical cancer, because it's very, very, very detrimental, especially also people who have immunosuppression. For example, people who have diabetes. When your immunity is really suppressed, you need to also go and do some screening for cervical cancer, because again, you have cervical cancer, really your quality of life really reduces. Yeah, so over to you, Dr. Brianna. Maybe according to the cancer you've heard about, which is the one cancer that you really hate to diagnose? Yeah,
One, two, cancer of the pancreas.
Yeah.
Ooh.
Very, 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 very aggressive.
The patients that I have seen with the problem with cancer of the ovary is one. It is a silent killer.
Very silent. Actually, I have a friend of mine who passed from it recently.
It is a silent killer. Cancer of the ovary will not show you obvious symptoms until it is too late. It is those cancers that have the vaguest of the vaguest. And the problem is that even its screening is not something that is very conclusive. Actually, most studies say they don't really, how can I say, vouch for regular screening of ovarian cancer as like it's due for cervical. Because then you do things like, so, but of course, definitely, this means that if you have a predisposition, say for example, you have a family history of any cancer. Now here, I won't break down what particular cancer is linked to what, but just know that these cancers, breast, ovarian, colon, they are a family of cancers. If you have had history of having one, or the family, somewhere, maybe your father died of something, please make sure, know that you're cancer predisposed and get yourself checked out regularly. The cancer of the pancreas. Actually, cancer of the pancreas is that cancer which its treatment of choice is surgery.
Yeah.
The problem with cancer of the pancreas is its pain. The patients have seen it. Not even going to cancer of the pancreas is too far, but cancer of the pancreatitis itself, or inflammation of the pancreas, the pain it causes is like a pain you have never experienced in this life. So for example, now that's why things like environmental factors, things like smoking, alcohol, banange people leave alcohol. Like alcohol is okay in moderate amounts, and I know moderate is a subjective term,
It's very
but
subjective.
leave it be. When someone has had pancreatitis or cancer of the pancreas, they will tell you. These are now risk factors for cancer of the pancreas. Cancer of the pancreas can be very aggressive. And remember, even if the pancreas is completely removed, it is an organ that basically controls entirely digestion. That is to say. So cancer of the pancreas can be caused by diabetes, can be caused by cancer of the pancreas. Whether you decide to remove it or you decide to treat it, someone eventually ends up with things like diabetes. And you find that at the end of the day, your quality of life is generally compromised. So cancer of the pancreas, cancer of the ovary, I just don't like to give the diagnosis. Unless maybe doctor.
Actually, with that cancer of the ovary, people come with the vaguest of syndrome. Very vague. Someone will say, I have no appetite. Okay, I have vomiting. I have some bloating, I have frequent urination. Like, it is so vague, extremely vague. And for the very, very, very few cases where it is quite advanced, you find someone actually having vaginal discharge, because now it has spread, for vaginal discharge. So, Dr. Hudson, which is the one cancer that in your practice you found very, traumatizing to actually diagnose, and what people should do to prevent this types of cancer?
Yeah, talking about cancers, I personally have encountered a number of them, and I don't like diagnosing them a lot sometimes, because I really feel like by the time most of our patients come to us, like we can do
End stage.
little about it. Yeah, so I have a first-hand experience where I had a boy who had, yeah, he was called Jordan, so he passed on. He had features, you would see him with features of stroke, a 6-year-old. So then you ask yourself, like, why would a 6-year-old boy have signs of stroke? Yeah, but then like when we went on to investigate, he had a brain tumor, actually called inoperable, a diffuse intrinsic pontine glioma. So it's just very complicated to operate because it's in that area which controls all your vital organs. So you can't really tamper with it. So we were very traumatized with the entire family and everything, losing like a 6-year-old, something like that. And I know that we've done a lot of advancement with neuroscience and neurosurgeries, but I personally, I find it very scary for me and worrying to diagnose those brain tumors because I find them a bit complicated, like when they operate and the prognosis and all that.
And the side effects of the operation itself. But I remember the mom of that boy. I love how she was so strong. That woman had strength, man. I was like, how are you even standing?
But it's I want to emphasize the fact that most of these cancers initially have a warning sign. And like when I was discussing with a parent, she told me that the boy was complaining of headaches from the age of 3. So meaning from the age of 3, it was warning them, but they didn't. By the time we saw all the symptoms and everything that was happening, it was too late. Yeah, so it's very important in whatever things that you might have. If you find anything that you find it's abnormal on your body, it would be a good thing to go to the hospital, try to find out what the cause would be, and then they manage it usually. If they get it early, sometimes the outcome might be good.
Okay. So in conclusion, guys, do you think cancer is a death sentence?
Maybe let him begin.
Yeah, okay. Personally, I think with the advancement that we've done in medicine, cancer isn't really a death sentence. I would say that cancer is not a death sentence because I've seen a number of people that have been diagnosed with different types of cancers, and some have been managed to complete cure, others have gotten they have gotten reliefs, others have gone into improved quality of life. Sometimes we reach a level where we just want to improve our quality of life. Someone has a cancer, but he lives without pain. He can do his other normal activities. So I would not really say that cancer is a death sentence. If you get it and we get it early, we can be able to do something about it and also have an improved quality of life.
Actually, when people hear that someone has cancer, they immediately think like, there is no hope for this one. This one is goners. Actually, that is not true. Like doctor has said, there have been so many advancements in cancer treatments lately, and people actually go ahead to get cured. They get into remission, and they actually have a very good quality of life after. So, guys, let's not lose hope. As long as this thing is caught early, it can be managed, treated, and someone can go ahead to live their lives the way they should have in the beginning.
So I think I completely agree with Dr. Hudson and Dr. Swalha. One thing that I know for sure, this is one thing I always say, and I believe so strongly, is that one, we are doctors. I know very well that I'm a doctor, and as a doctor, medicine has limitations. I believe that doctors treat, but God heals. There's so many times you find people will say, maybe someone can say have you seen the specials whereby, like, of course, according to the statistics and to the science and to the facts, a person has like a 5-year survival rate or less. And the person goes on to live for 20, 40 years. That's something that medicine cannot explain. And these are things that actually do happen. So for me, I believe that cancer is not a death sentence. There's those facts and all those things, and God does the healing. However, I also believe that please, in the meantime, do things you have the knowledge at your predisposition. That is why we are here. That is why we're actually putting ourselves out into social media, because actually most doctors aren't really comfortable with being like this. Most doctors actually don't do this. It's something that is very difficult, even generally in Uganda, in medicine, in general. It's a very new concept. But we're putting ourselves out there because people, number one, really do look for knowledge. The lack of knowledge or health literacy has such detrimental effects. People don't even know who to talk to, who do I go to. So because we are here so that we can talk to you about these things. And by the time you get this knowledge, you never know what it is that you learn. Come for the exhibition, these things, come and learn new things. Talk to people. You will make doctor friends. Doctors are really friendly people. Have someone that you talk to on a regular basis. Be like, I've been hearing of this thing and it seems a bit funny. What do you think? Instead of hearing rumors in the background, then you take them on. Seeing things on TikTok, on Google, anybody can put things on Google, on TikTok. Anybody, even a 6-year-old can wake up and type things. Let me say, for example, I don't know anything about maybe aircraft engineering or whatever. I can go to Google and put some kind of document or paper. Who is going to come at me? No one.
Say that this is wrong.
Exactly. So that is the thing, because we are doctors and we are health workers, and these are things that actually bother us because of the amount of impact that we see it does to people. Come and talk to doctors, talk to health practitioners, get right information, get screened, get all these things, and you notice the types of illnesses which are much rarer in urban populations. People who have more knowledge, they tend to do a bit better for themselves and their lives, honestly speaking. So, yeah, that's what I have to say.
Okay. So thank you very much, Dr. Brianna, Dr. Hudson. I feel like this was a very, very informative session, and thank you everybody for listening in. We are having a medical expo in September that's going to run from 7th to 9th, and we are hoping to see you guys there. Please come one, come all, call a friend, call 2 friends, and come and listen to the doctors. Come and get free screening for different ailments that you have. Come and look out for insurance companies who can provide good health packages. Basically, come and get free consultations from at 5,000 shillings. You get consultations from very, very many specialists. So, I think this was very, very informative. Thank you very much.
Thank you too.
Yeah.
Thank you.